Does this sound familiar? You're out and about, and all of a sudden, that urge, it's there. You have to look for a restroom immediately. Or you're out with your friends or family, or you're at home and you're laughing, and all of a sudden, it happens. Or you're at the gym, get your workout in, and it happens. Or you cough, or you sneeze. We're talking urinary incontinence, and it can impact the quality of your life, and it can be a serious matter.
Overactive bladder actually falls under the urge incontinence, where you are, I gotta go. I gotta go right now. Get out of my way. I'm gonna knock you over to get to the bathroom.
We'll be back in a flash, a hot flash. Hello, everybody, and welcome to another episode of the Ageless Glamour Girls Podcast, where we talk all things aging on this beautiful and sometimes challenging, often challenging, but liberating journey, and nothing is off limits. I'm your host, Marquita Curtis Haynes, CEO and founder of the lifestyle brand Ageless Glamour Girls, which celebrates, embraces, empowers, motivates, and sometimes entertains women age 50 plus. We're so glad you're here. I hope you're ready to learn more about intimate wellness. That's a very, very important topic. Now, I've never met today's guest in person, but a friend introduced us, and she referred to her as the Vagina Whisperer. I'm like, oh my goodness, I have to have her on the show. That is, I just love that title. Meet Dr. Briana Walton. She's a specialist in female medicine and pelvic reconstructive surgery. She's owner of the Center for Feminine Wellness and Surgery in White Plains, Maryland. Welcome to the show, Dr. Walton.
Thank you so much for having me. And I'm so glad she introduced us. This is going to be a lot of fun. I can't wait to talk to you.
Oh, good. Yes. Thank you. All right. We want to start with the big question, of course. What exactly is urinary incontinence, also known as overactive bladder?
So you actually bring up a good point, because incontinence is an accidental loss of urine. Okay. It could also, you could have incontinence that's also bowel related, but we'll save that for later. But when you're specifically talking about urinary incontinence, there's different, flavors. Okay. Overactive bladder actually falls under the urge incontinence, where you are, I gotta go right now. Get out of my way. I'm gonna knock you over to get to the bathroom.
Exactly.
Versus stress incontinence, which you mentioned in your introduction, like you're coughing, you're laughing, you're doing a squat in the gym and something comes out, or you're dropping it like it's hot, right? Like those are the things that make you leak. You could even have a combination. It's the gift that keeps on giving. You could have both. And then there are women who actually have more and more, as we get older, functional incontinence, meaning that you don't walk fast. You have mobility issues. You can't get to the bathroom quick enough because your body won't allow you to. So there are a lot of different varieties, but the most common two types that I deal with on a regular basis are stress and urge.
Okay. Yeah, that pretty much covers it. A lot of information there. Yes. Now, I did read an article about the structure of our bodies. How do the structures of our bodies, play into this incontinence, urinary incontinence?
Another good question, because a lot of people come to me and they're like, you're the vagina whisperer. You just, all things below the belt. But quite frankly, when I see people, I am doing not just a look at your vagina and let me see or feel, but I want to know about, do you have any hip or back issues? Do you have any knee issues? Because being off kilter will affect the pelvic floor. And the floor is not just, the muscles, it's everything that connects the muscles to the bones. So it's the ligaments, it's the tissues, it's all of those things that support the pelvic organs and keep them stabilized, whether you're jumping or bending or whatever activity you're doing. So women who have lower back problems, who have hip issues, who broke their knee, they can be off kilter and shift pressures to affect the pelvic floor. Or just think about every woman who has had a baby has altered their posture. Their bellies are out, their back is different, so they have more of the curvature related to it. And that can have some long-term effects, especially when things start to loosen up.
Wow. That you raise a great point because, with the hip and knee surgeries, you might, you're off balance to begin with, right?
Right,
You know,
right. Especially most women are counseled that they should wait until the pain is so bad before they have a hip or a knee replacement,
mhm,
right? They say, wait, wait, wait. But
mhm,
over time, you are constantly bearing weight differently. And who's accommodating for that? Who's compensating for it? Your
mm,
hip, your back, your
mhm,
abdomen, and your pelvic floor. Everything is trying to adjust in relationship to being off.
mm. I didn't even think about that.
Yes,
Those are
ma'am.
those are excellent points. Excellent points. Now I know that just talked about the common types of incontinence, stress
Yes.
and urge. And then we'll get back to the pelvic floor in a minute because that's very important. But I want to know, how does, in general, and you mentioned this a little bit, but I just want to talk about it a little bit more.
Mhm.
How does urinary incontinence impact one's life?
Yeah, when I first started practicing, and that was, in the 90s actually, most of the patients would say, "Oh, I can just deal with it. I'm not gonna, I'm not gonna have this surgery." And everybody was concerned about having surgery. But when you look at the data and you know that about 1 out of 3 women will change their practice patterns in terms of sexual function,
Mhm,
2 out of 3 women will stop doing the things that they love doing because they're afraid of leaking. They won't go to church. They won't go to the
mhm,
gym. They stop participating in social activities. And
mm,
so that has a future impact on anxiety. I'm scared. I'm worried. I'm nervous. I'm going to pee on myself, and
mhm,
depression. I'm
mm,
not socializing like I was before. So it
mhm,
has a lot of sort of mental health impact. But
mhm,
then if
mhm,
you look at even further, we know that women who are rushing to get to the bathroom are increased risk for falls. And so
mm. I didn't think
falls
about
can
that.
cause hip fractures.
Right.
And hip fractures can result in a couple things: surgery,
Mhm,
institutionalization. So if you can't toilet yourself, you're much more likely that for your family, if they can't take care of you, if you're getting to the point where you're on your own, but you're not
mhm,
quite sure if you can stay on your own, you
mhm,
start having problems with toileting. That's your admission straight to somewhere else to
mm,
have someone else to help you. And that's the thing that we want to encourage. If you want to stay independent, if you want to continue to do the things that you want to do, if you want to have a aging well, right?
mhm,
You've
mhm,
got to
mhm,
take care of these things that may seem like not that important.
mhm. Wow. That all excellent points. So much great information. And you reminded me of someone recently told me when I told them I was going to do this podcast.
Yeah.
And she was like, on the job, there's one restroom right by everybody's office, right? And she says sometimes she has to go so badly when she gets there, it's occupied. And so
Mm,
I just thought about what you said, the anxiety. The
mhm,
anxiety sets in. It's like, what am I
mhm.
going to do? I have to go back to my job. I have to go back to the desk. So yeah, it's tricky. Um, so the question, uh, this begs the question: is this fixable? How do we manage urinary incontinence? For example, should we cut back on our alcohol, cut back on caffeine? And of course, once you hit 50 and 60, are pelvic floor exercises or Kegel exercises still relevant?
Mhm.
Let's talk treatments. And I want to start with self treatments, such as some of the ones I just mentioned.
Sure. Well, I think the key is figuring out, first of all, what flavor you have. And
Mhm,
so if you're talking to your primary care, whether that's a physician or a physician extender like a nurse practitioner or PA, you're going to talk to them about your symptoms so they can make the right diagnosis and then potentially even send you to somebody like me, right?
mhm, mhm,
But even before you get there, there are reversible causes of incontinence. So if you have infections, you want to make sure you don't have recurrent infections all the time. Even menopausal changes like the thinning of the tissue can reflect or cause issues in the urethra and the bladder. So you
mhm,
end up going to the bathroom too many times at night. You have
mm,
more urgency. So those are things that we can pretty easily treat with just
mhm,
like minimal interventions.
mhm,
A
mhm,
lot of women, unfortunately, put things into their diet that are bladder irritants, things
oh,
like caffeine. We know about caffeine. We usually say, oh, I got to cut back on my caffeine.
Mhm.
What a lot of women don't know and understand is that a lot of the dietary supplements like phenylalanine, the stuff we use to cut down on our calories,
Mhm.
Diet Coke, diet products, that irritates the bladder too. So you've got to
Oh.
be careful about your balance and make sure you're just getting water in your diet as
Mhm.
opposed to just putting Crystal Light in everything.
Right, right. That makes sense. That
Mhm.
makes sense. Now, and what about the pelvic floor? You know, I didn't have
Okay,
children.
let me ask you a personal question, Marquita. Come
Okay,
on now, let's talk personal. You said
okay,
all things, so we're going there.
right.
Uh, have you ever been instructed in your years of going to see the provider?
Mhm.
How many times have they taught you how to do Kegels?
Oh my goodness, you have jokes. Never
No,
ever,
I'm serious.
but never ever. What I learned, learned from friends or in books or whatever. My mother certainly didn't tell me about that.
Right.
And then it worked back then, but does it work now? You
So
know.
there are little hints that you're doing them correctly, but it's really good for us as a provider to
Mhm.
teach people how to do them when they're doing their pelvic exam. Okay?
Oh.
Because you grade the ability of somebody to do a Kegel. If they're really good at them, then they could potentially be very effective for incontinence. If a patient has had a birth injury, because one of the main risk factors is a
Mhm.
vaginal delivery.
Okay.
You had a big headed baby come through your
Mhm.
pelvis, right?
Mhm. Mhm.
And you had a long labor, or you had forceps or a
Mhm.
vacuum,
Mhm.
and it changed your pelvic floor and the muscular ability to contract those muscles, right? Then sometimes Kegels are not going to help you because you don't have the ability to contract those muscles.
Mhm.
So why
Mhm.
would I tell someone who's in a wheelchair who's paralyzed to practice walking? Right?
Right.
So that's the,
Makes
the
sense.
the analogy I would use. If
Mhm.
those muscles are damaged,
Mm.
sometimes it's not helpful for you to actually go do Kegels on your own. And if
Mhm.
I've assessed that somebody is you're okay,
Mhm.
but you're not great, then
Mhm.
we can add a physical therapist, like your own personal trainer for the
Mhm.
pelvic floor. They'll teach
Mhm.
you. They'll teach you how to do them better.
Mm. Okay. And here all along, I thought that Kegel was
A Kegel is a Kegel is a
for the
Kegel.
sex, for make it better. Yes, yes, yes.
And it
You're sitting at a red light, you're doing it right.
yeah, I mean, I don't know what you want to talk about today, so I'll go there. But I mean, you're talking about
There's
grip
so much.
ability.
Oh my
That's
goodness, there's
one
so much.
thing,
But
the
but yes, so
therapeutic
Kegels.
side.
Okay. Now, how are they related to pelvic floor exercises?
How are the
And
muscles?
yeah, the Kegels, are they connected at all? And
Yes,
and,
it's the
and going
same thing.
and going back to something I was about to ask earlier, I don't know if I asked. It's like, do they still work if you're over 60? The
Yes, it
Kegels
can work
and
if
the
you're over.
pelvic floor exercises?
Yes, I've been very impressed with some people. I'm like, oh, don't show. I'm doing an exam on a patient and I
Mhm.
have my fingers in. I'm saying, okay, I want to check your pelvic floor muscles. So I want you to pretend like you're picking up a penny with your butt. That's the
Oh.
best analogy. I'm doing it right now. That helps you to sort of guide the muscles into the right position where you can assess how strong, how long, and what direction are they going, because there's not just one component, there's multiple components to strength. Okay.
Hmm.
And so when I'm doing that, sometimes I'll say, well, don't brag. I mean, I know you get this, you're good, but you don't have to show off.
Right. Oh my goodness. Uh-huh. But yeah. Okay. So, all right. So you're telling me that it still matters, that I can still practice. You
Okay,
know.
you want to know a secret?
Yes,
You could
please.
check on yourself. You could check your ability to do those contractions on your own.
Hmm.
You take your dominant hand,
Hmm.
you take your thumb, you insert it inside of your vagina,
Okay.
and you do a Kegel. And if it's thumbs up, if
Uh-huh.
the thumb comes up and it stays up for a good 4 seconds, you've got good Kegel muscles. If you feel nothing, you are not doing them right, or you don't have the ability to do the exercises. Okay. That's a
Okay.
quick and easy way, down and dirty, to figure it out for yourself. We used to
Wow.
say, when you're in the restroom, stop
Mhm.
the flow. But
Mhm.
don't do the bladder like that. The bladder is either supposed to store or it's supposed to empty. Don't confuse it. Don't go back and forth saying stop, start, stop, start. Let it either flow or let it hold.
Oh wow, because I've been yeah. Okay, let's stop this flow right now, please. Let's practice while we're in the bathroom. Okay, good to know. Good to know.
You need
Okay.
a commercial break to test your Kegel.
Okay, everybody, we're gonna take a little break, but we'll be back in a flash, a hot flash. We're
Thumbs
gonna
up.
check our Kegels. And we're back. Okay. Okay, so we got the Kegels, we got the pelvic floor exercises.
And the pelvic floor physical therapist, your
Physical.
personal
Okay.
coach.
Mhm.
So they are really very helpful because they can empower you to really learn more about your body. There are women who really don't understand from even a sexual function
Mhm.
standpoint
Mhm.
the ability to use those muscles during intercourse
Mhm.
to really enhance or change their satisfaction. And
Mhm.
so just understanding and knowing that sometimes is like really gratifying for a patient to really say, I know my body. I own this body. My body does what I want it to do instead of it doing what it does.
Mhm. Mm. That makes sense.
Mhm.
And I also want to point out, not I have never given birth to children, to any
Mhm.
babies,
Me either.
unfortunately, but that doesn't matter. You
No.
still have issues.
Yep. Especially if you've had any changes in posture or structure. So
Mhm.
lower back issues.
Mhm.
I've gained weight and lost weight, and that has affected me in terms of my ability. The more weight, it's just like the analogy we use on the knees. The more weight
Mhm.
loss you have, the less pressure it is on the knees. The same for the pelvic floor. So sometimes losing significant amounts of weight can affect your urinary incontinence pattern. Um,
Oh, shoot.
yeah. It just
Who
the gift that
knew?
keeps
You
on
did.
giving,
Now
right?
we know.
But think about you as a strong woman, right? Like a lot of us, like, oh, I can do that. I can lift that,
Mhm.
refrigerator.
Mm.
And we do things that put ourselves at risk. We're doing heavy lifting, or let's say you have problems with chronic constipation, you're straining, you're
Mhm.
pushing. That straining can damage the pelvic floor muscles. It can damage the nerves. And so you can end up not just with bowel dysfunction, but you can end up with bladder dysfunction because you're straining all the time.
Oh my God. Okay, I'm serious. Who knew? So constipation is
Yeah.
related to urinary incontinence. And we're talking about urinary incontinence.
Yes, ma'am. Yes, ma'am. You can be constipated to the point that it causes incontinence, but the chronic straining related to constipation can have a long-term effect on incontinence too.
Wow. Wow. I know that if you get really, really constipated, sometimes you can't urinate, you can't even pee. It's
Right.
like, so you have to handle that. And I just thought about all the people who are on the Ozempic, the
Right.
constipation. That's one of the main
Yes.
problems with that. And yeah.
Yeah, I think, we don't and haven't really appreciated the sort of interrelatedness of the pelvic floor.
Mhm.
When I introduce myself as sort of a urogynecologist or pelvic floor specialist, I
Mhm.
say it's like, a gynecologist and a urologist got together and they had a baby. That's me. Um, but quite frankly, we are also doing a lot with colorectal work, and everything we do is
Mm.
sort of below the belt. So
Mhm.
any compartment that's below BBB, bladder, bowel, or bulges, we are taking care of those issues as a urogynecologist.
Okay. Later on, you have to let me know if you know anyone in my area where I live that I can go see. Otherwise, I'm
Absolutely.
gonna have to be on a
Absolutely.
airplane, come to see you in Maryland. I'm just saying.
You could.
Okay.
I'd love
All right.
to host you.
Phew. I was talking to a couple of women, and somebody also mentioned, um, since we're still talking about self treatment,
Mhm.
um, Pilates
Oh,
or yoga. Does that help? Do they help?
Yeah, absolutely. In fact, if a lot of my patients are too busy, like, if you told me in my life where I had to go to see a pelvic floor physical therapist, I couldn't do it. Like, I don't have time.
Mm,
So doing Pilates and yoga is almost the equivalent of some pelvic floor exercises because you are working on your core, floor, back door. That
mm,
really is learning how to strengthen that sort of trifecta to
mhm,
keep things supported, and helping maintain your balance and posture. I think is equally as important when you're talking about getting older and
mhm,
trying to make sure you navigate to the bathroom without
mhm.
a fall or a trip.
Yes, yes, poor us. To age, as my mother used to, as my mother once said, I said years ago, and when the dementia was coming on, and I said, Mom, because she had a toward, upbringing. She grew up growing up in Mississippi. And I'm like, Mom, you have to write a book. And she's like, You think so? I said, Yeah, Mom. But by this time she was like 88 or somewhere, 89. And I
Wow.
said, Okay, I said, what? I said, we need a title. What are we gonna call it? She's like, and she had still gray eyes. She looked at me, she's like, Aging is hell. I'm like, Mom, well, she used to also tell me, just keep on. When I would ask her questions, she would always say, just keep on living, just
Yep.
keep on living. And
Yep.
now yeah, okay, all right, we could be here all day.
We
Oh my
could.
God, yeah, we should go live. Okay, now we talked about the self help kind of stuff you could do,
Sure.
the Kegels, the Pilates and stuff like that. But I
Diet.
want to talk about medications. What's on
Mhm.
the market today? How do they work? I'm hearing suppositories, types of creams you rub in, and tell us what's up with that.
So it depends on the type of incontinence. Generally speaking, for stress incontinence, the first sort of way to address it is the exercises. But medications really don't have a role in stress incontinence.
Oh,
It tends to be more for overactive bladder. Okay, and
mhm,
I like to joke with patients. I like to say things that make them remember. So overactive bladder is a lot of fun. Frequency, urgency, and nighttime urination. If you have that frequency, urgency, and nighttime urination,
mhm.
and are you dry fun or you wet fun? You leak on yourself or not? That's overactive bladder. That is a category where medications really probably has the best impact. And we're
Mm,
talking about OAB drugs like Detrol, Ditropan, some of the new ones on TV that you'll see, Myrbetriq,
mhm,
Gemtesa. Though there are a lot of different varieties, and
mhm.
most of them really focus on making the bladder either relax or decrease the spasms to give you a
Mm.
lot more time to get to the restroom. Those
Okay.
medications can be fairly effective, but some
Mhm,
have side effects, right?
mhm.
Some categories will cause dry mouth, dry eyes, and unfortunately, constipation. Others can affect your blood pressure. So we try to find the right one, but it ain't up to me, right? It's up to your
Mhm.
insurance company. That's the sad,
Don't
sad reality.
don't get me started on that. And once you get on Medicare, oh, sorry.
Right. Now, what a lot of people don't know is that if the medications are either not as effective or
Mhm,
or they have side effects, you can
mhm.
actually start looking at Botox. So Botox.
Oh, that was my next question.
Oh,
Yay,
okay,
Botox.
good.
Okay, let's talk about Botox and the vajayjay. All right.
So Botox can be in the vagina for pain, but we use it in the bladder to calm
Mhm,
it down. So think about it when you inject it in your face, you're
mhm,
doing it to relax the wrinkles, to kind of soften things. It does the same thing in the muscle of the
mhm.
bladder. It relaxes it so it gives you a lot more time and more storage capacity. The beauty of Botox is that there aren't a lot of systemic side effects. You're not going to get dry mouth, dry eyes, or constipation related to it.
Mhm.
The key is we use a set amount so that we don't overdo it, because the worst thing than leaking on yourself is not being able to pee. Okay.
Mm,
When you
mm,
can't pee, you're either having to catheterize yourself,
mhm,
and that's not something that we want to run to. So we keep our doses really low.
mhm,
Now, usually most people will have 1 to 2 doses per year, and
mhm.
that can be in the office now. It
Oh,
doesn't have
okay.
to be under anesthesia.
Mhm, mhm. Okay, that here again, you're chock full of information. Oh my goodness, Miss Vagina Whisperer. Okay, now I know this is serious stuff, but now can you also get surgery for this? And what does that entail? I know I think you can get surgery for fixing, tighten up the vajayjay, and stuff
Sure.
like that.
So,
But
so let's
is
let's
that
differentiate because there are a couple different types of procedures. I'm gonna share some information. I hope it's okay with your listeners to
yeah.
tell the truth about myself.
Mm-hmm.
Because I'm over 50 now.
Mm-hmm.
One of the things that I, went into urogynecology was my appreciation and love for surgery and anatomy and that sort of thing. And when we
Mm,
first started, we were doing very large incisions
mhm.
on the abdomen like a C-section. Then I went to training. We did laparoscopic procedures. So I was the first fellow in my training in Boston at Harvard.
Mhm.
And when we first started, we were doing laparoscopic procedures, little belly button procedures. But now,
Mhm.
and what we've done in the last 20 years is go through the vagina and make a
Mhm.
small incision, only big enough for my finger, to put a little strap of material under the urethra like a little hammock. And that can support the urethra and
Okay.
keep you from leaking when you laugh, cough, or sneeze. And they're very reliable, fairly quick to do, limited recovery time. So we like them because it's much more even cost effective.
Mhm.
If you think about how many pads do you go through, how much, how many dry cleanings do you have? What do you have to do in terms of paying for your incontinence? If you add that
Mhm.
up over time, sometimes even just doing surgery earlier,
Mhm.
especially when most women wait years and years and years
Mhm.
before they do anything,
Mhm.
that's the key. Um, but I'm going to throw in the other area where incontinence may not be detrimental, but bothersome, just like
Mhm.
annoying.
Mhm.
You occasionally will leak. You're
Mhm.
occasionally having problems. There are some newer techniques with energy-based therapies
Oh.
using a laser or radio frequency to
Mhm.
help treat the tissue. Now, what it does is, if the equivalent is, think about when you fry an egg, you
Mhm.
don't change the egg, but you denature the protein. You change it from a liquid form to a
Mhm.
firm form. When you heat tissue, you
Mhm.
tighten collagen, but you also send a signal to the body that I've been injured. So I'm going to send in more collagen. I'm going to send in more blood vessels. I'm going to send in growth factors to help you recover from this injury that you caused. And so
Mm.
that's sort of the thought process around early stage leakage, that you could potentially have some impact with some of these newer therapies. And there's a lot of newer studies that are going to happen over the next few years to really document this.
Okay. Now, when you say early stage, you mean like if all of a sudden you're doing it now, and it's like, what the hell? So that's an early stage.
Well, I would say early stages, I've got a lot of young moms who they've got toddlers at home and they occasionally, like maybe once a week,
Mhm.
twice a month,
Mhm.
it's not detrimental that they have to wear a pad every time, but
Mhm.
it's not predictable. And that's a problem that I think a lot of people have, is that when they can't predict when it's going to happen so that they can either prepare with a pad,
Mhm.
that makes it really challenging. Nobody wants to be in the middle of sex and how all of a sudden they start leaking, right?
Oh my God, that happens
Yes, it can
during
happen.
sex? Oh my gosh.
But I would
Okay.
say just blame your partner. They won't know.
That there you go. Blame it on the boogie.
It wasn't me.
and and going back to the surgery, what's the name of that surgery?
So there is the general category is a sling, a mid-urethral sling.
Okay.
What I talked about with our mutual friend are the Altis sling, ALTIS,
Mhm.
which is basically a mini sling. So it goes in through one incision, and instead of having exit points, it gets anchored into tissue or structures to help hold it in place. And it's adjustable
Okay.
so that it's not one size fits all. You try to tighten it in response to how bad the leakage is, and you stop when you corrected the leakage. So you can
Mm.
do that as an outpatient procedure, meaning you don't have to stay overnight in the hospital. And
Okay.
most patients can go back to their normal activities pretty quickly.
Oh, okay. Here again, that is good to know.
Yeah.
Let's see the surgery. That. All
Well,
right. I want to.
the
Oh,
other
go
thing
ahead.
that I was going to just say is that, there's the one thing that we didn't talk about are pessaries, so pessaries are a device, right? Like,
Okay.
remember diaphragms back in the day?
Yes, never had one, but I remember them. Yes.
Okay, so a pessary is like an industrial strength diaphragm. It's thicker. They come in different shapes and sizes.
Mm-hmm.
They basically fold and are placed inside of the vagina and essentially lift up parts of the vagina that are either falling or leaking. And so
Wow.
if somebody doesn't have time, not a good candidate, or doesn't want surgery, a
Mm-hmm.
pessary is a really good. So I kind of explain it like a vaginal tampon. So
Mm.
it's
Okay.
a good way for you insert it, you remove it. I don't have to do it. But if you can't do it, we leave them in for a length of time.
Okay. Who
So
knew?
let's say if your mom
Hmm.
and I don't know if is she still alive?
No, I
I'm
wish. 4 years,
sorry.
4 or 5 years now.
I'm
Yes. Hmm.
sorry.
Yeah.
But if
Thank
she
you.
was having incontinence, she said, I just don't want to go under anesthesia. I'm nervous about not waking up if I have
Hmm.
it. A
Hmm.
pessary is a really great intervention because that way it would cut down on some of the leakage. We could leave that device in there. They would come in 4 times a year to be checked just to make sure it's in the right place and space. And
Hmm.
it has a very low risk of side effects.
Mm. Okay. I like that.
Yeah.
Here again, you better get some insurance. Everybody, keep your insurance. Oh my God, just yes. You know what? But and before we go on to my next question, I want to read something to you because I asked a couple of women about urinary incontinence, and this one lady was saying she doesn't have it anymore, and she says, "I'm not sure what happened to make that issue go away for me, but I think overall, better kidney bladder health definitely must have helped." She says, "I took a lot of supplements for kidney and bladder.
Hmm.
I'm not sure if it was connected to several UTIs, but when those cleared up, she didn't have urinary incontinence anymore."
Hmm.
What's up with that?
So again, just trying to clarify what kind of incontinence she had, because that's
Hmm.
an important distinction.
Hmm.
But just in terms relative to the supplements, one of the things that happens is that if you start to correct the what we refer to as the microbiome, those are the bacteria, those are the community of bacteria that live in your bladder, vagina, and bowel. If you change the pH and make it unfriendly for certain bacteria, you can change the stability of the bladder. There's
Mm.
newer studies that are coming out about that. I think the other question is, did the young lady start to lose weight in response to taking care of herself a little bit better? When we start
Okay.
doing supplements,
Uh-huh.
are we also doing other things in terms of lifestyle that might
Okay.
have been helpful?
Hmm.
Is she doing more exercises? Is she walking more? Is she becoming
Hmm.
more active?
Hmm.
I don't think it's one answer. Oftentimes it's the collective. As
Hmm.
I also say for risk factors, it's not usually one thing that has caused the incontinence. It's one hit, then two hits, then three hits, and then you're down, right? And it's
Hmm.
not usually you're all of a sudden bad. It's progressive over time.
Mm. And then the medications, as you get older, a lot of women will get high blood pressure, and then one of the prescribed medicines is a water pill.
Yep, you got it. You got
Ah,
it. And so I often will hear the primary cares have told their patients to take their water pills at night, right? But, you
and
know, you want to wake up how many times, in order to empty your bladder. So it becomes sometimes a struggle. And that's why a good relationship between your providers is really important.
mhm,
I think one of the things that has been beneficial with electronic records is that I can talk to my colleagues a lot
mhm,
easier when we have the same patient. Like, I want to be able to say
mhm,
to my colleague who's taking care of my patient, hey, I would like to switch your water pill to daytime. What do you think about that? And
mm,
I don't want to have to make
mhm,
a phone call and wait for it. I want to just
mhm.
send an email or a text.
Yes. And that's the beauty of being in the same system where with all your doctors, because
Yes.
they share their records, and I
Yes.
love that. Love that. Now, and speaking of providers, when is it time to see your doctor about this? And does it matter what kind of doctor we see? I know we talked about that earlier.
Mm-hmm. I think anytime you're bothered, they should be told.
Mm-hmm.
Anytime you have a problem that you're changing your life and lifestyle, you need to talk to somebody about it. And it doesn't matter if it's a physician, a nurse practitioner, a PA, talk to them. It doesn't matter what specialty, talk to them, because the key is they can initially start some things that don't require a specialist.
Mm-hmm.
I think seeing a specialist becomes much more important when you're thinking about surgical intervention or when you're complicated, right? Like you already had a lot of different things done. You've got not one problem, but more than one, like prolapse and incontinence. And I know we didn't talk about that, but those are things that come together very commonly.
Yeah, that sounds familiar. I think I ran across that prolapse when you mentioned that. Now,
it's pretty common.
Now,
one in three women will have some form of a pelvic floor disorder, which is either urinary incontinence, bowel issues, constipation or fecal incontinence, or prolapse. The pelvic organs are bulging or dropping into places.
Right, that's what it was. Yes, I ran across that. Yeah, in my research, because I love doing research. Okay, wow, so much good information. Now, you know the deal. I want to talk about when you're out and about. You're at the mall or whatever. It helps to know before you go, right? You want to pinpoint those things. And there was a quote out. It's like, you're getting old when you're going out, and the first thing you do is you look around to see where the nearest bathroom is.
There's a term for it. It's called bathroom mapping.
Oh, bathroom mapping. I like that.
Yep. Just like when you are that person where you're like, okay, where are all the bathrooms located? And or you're going to the same route and you know the bathrooms along that location. That tells you there's a little issue. There's an issue.
And on the sidebar, if you're on the road, on vacation or you're a road trip, of course, men could just pull over and just and that's it, and keep on rolling. It's like,
right, literally.
Not us blessed women. All right, now
you told me there's an app, right?
So yes, that was the next question. Yeah, when you mentioned the bathroom mapping, yeah. I ran across that in my research that there are bathroom locator apps. And there's more than one. I think there are like 5 or 6 out there. This sounds like a good plan to me.
I think it's a great idea just to find out, like, and I wonder if some of the apps tell you how, if you rate the bathrooms, because, I used to do a lot of medical mission work. And so I said, I've peed and pooped in the most interesting places in the world.
Yes. See?
but it would be nice to know the cleanliness, the accessibility. It's like a Tesla station. How many are available? Is it one?
Right. Exactly. Because when you gotta go, you gotta go.
You don't want to have to keep looking around. I've suffered that. I made the Uber driver pull over once and say, I gotta go. I can't stay. You're gonna have to stop. Unless you want me to pee in your car, you will stop.
See, that makes sense to me. That makes sense to me. And going back to what you said about rating bathrooms, I started, I guess like 2 or 3 years ago, I started taking pictures and stuff inside the stalls. I'm like, now how does this look? We're in our bathroom, for women, we're squatting, and then we have to try to maneuver this big thing with the toilet tissue. Yep. That's why I have to get my tissue in advance. It's like, I'm always like, and can we have every bathroom just push the door out instead of coming in?
Right.
It's not asking for too much.
Not asking for too much. And, so the one of the things that I find interesting for women is, and you made a point that there almost needs to be a green book for bathrooms.
Totally.
But when you sit down, your sort of hygiene and posture allow the labia to separate and you to relax your pelvic floor optimally.
Mm.
When you're standing, sometimes our tissue gets in the way, right? Our labia, are covering it up. And
Ooh,
so the stream deviates. It can run down your leg instead of
yes.
to the toilet.
Yes.
Okay. And
Women,
so
we catch
that
it. We
makes
catch it. But I'm sorry. Go ahead.
it makes it a little challenging when you can't get to the bathroom fast enough to put your
Hmm.
paper down, right?
Hmm. Hmm.
So
Hmm.
really trying to use and having a good strong pelvic floor so that you can separate your legs wide enough to get the labia apart,
Hmm.
right? And then be able to squat far enough
Hmm.
to allow the urine to flow so it doesn't hit your legs. Because imagine if you have back or hip issues, you
Right.
can't do that very well.
You
You
can,
can't
right.
get low enough.
Hmm. Hmm. That's yeah, yeah. That's why I said more women need to be in the field of designing the bathrooms and the stalls and all of that,
Mhm.
because yeah, it is what it is. And I have a group, the Ageless Cafe, which is that's our the chat room for Ageless Glamour Girls,
Yes.
and we did a squats challenge once. It's like, and I'm always stressing, it's like you gotta squat if you can. I mean, because we have to squat constantly. We
Yes.
have to squat, so you better try to keep all of that in check. But now, when you talked about the bathroom, finding a bathroom, and I want to know, is there something psychologically about this when you're at home, or it doesn't matter if you're at home or out and about, and you have to go, and then because I'm looking at right now, I'm looking at the room where the closest bathroom is, and you know, and sometimes you jump up, and the closer you get, it's like a science fiction movie. The
Yes.
closer you get, it seems like the further away the bathroom moves, and
Yes.
the closer you get to the bathroom, the harder it gets to hold it.
Yes.
Is that psychological, or
Well, I
what
think
is
it's a
that?
combination of events. So, I hear people and we call it key in the door incontinence. As soon as you get that key in the
Yeah.
door, you
Mhm,
start that dance. And so
mhm,
some
mhm.
people will call home, get the door open for me, and don't let
See,
anybody be in the bathroom because I'm on my way and
exactly.
I'm coming in hot. I'm
Right.
coming.
Right. 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 And you know what? And that reminds me, if you're out at the airport and you see someone in the ladies' room in the stall, and they're standing really close to the door in their stall, and their feet are facing the door, that's me, because it's like I've gotten in the bathroom and then I have to just stand there before I can do, okay, I'm here. I'm here, and I have to calm myself down and take deep breaths.
Perfect segue, because
Mhm.
that's one of the things that our pelvic floor physical therapists do a really good job of teaching patients relaxation techniques to distract that bladder, to
Mhm.
retrain it. The
Mhm.
bladder is trainable. It
Mm.
just starts to act up as we get older due to menopause and hormone changes, to chronic issues with, again, either orthopedic or neurological problems.
Mhm.
And
Mhm.
so by learning to relax the pelvic floor, take deep breaths, sometimes even just doing a Kegel will
Mm.
suppress the urge.
Oh, okay. We'll
Yes, so
support
that's
her.
why physical therapy can be extremely helpful to just learn some techniques. It may not take your incontinence away, but if it brings it down to the level where it is functional, where
Mhm.
you can actually do the things you need to do and get
Mhm.
into the bathroom without it running
Mhm.
down your leg, it's
Mhm.
worthwhile.
You know what? That's an excellent point. I've never thought of that. I don't know anyone who's thought about that, to go to physical therapy to learn some of the moves, some of the
Mhm,
things you can do. That
mhm,
is a great point.
mhm. And
Excellent.
it's usually covered by your insurance, regardless of what you have.
Mhm.
Most people, even if they're on Medicare, will have up to 20 sessions a year. So
Mhm.
you don't need 20 sessions of pelvic floor physical therapy. If you do
Mhm.
the exercises well and they can teach you some techniques, you probably go
Mhm.
3, 4, 5 times, and you're
Mm.
good. At
Right.
least you've learned some habits and some techniques to help mitigate some of the symptoms that you described.
Okay. I love that. And also, when you're out and about, it helps to just carry some extra pads around, just in case. And a friend of mine told me she keeps extra clothes in her car.
It's the unfortunate reality that I
Mhm.
think some people do that because they've. I'm going to say this, no judgment. I think as a woman, we have a tendency to be more kind to the people we care for than kind to ourselves.
Mm, mm-hmm,
And so
mm-hmm,
most women will neglect their own symptoms for years and ignore them to the point where they get fairly severe symptoms, right? And then it makes it harder to fix. So
yeah,
my encouragement is you're the guardian of your galaxy.
mm-hmm,
Own it. If
mm-hmm,
you're starting to have symptoms, complain about them. Don't
mm-hmm,
wait until they get so bad that you have to do something.
that's right. Mm-hmm. That's an excellent point. Excellent point. And yeah, and I want to just touch on one more thing. Well, two more
Sure.
things. The pads. We talked about the pads and stuff, but
Mm-hmm.
with the surge of the older population comes a surge in the sales of pads, disposable incontinence
Mm-hmm.
products.
Mm-hmm.
But then I read where a lot of people are relying on pads, and instead of getting treatment, they just wear the pads, wear the pads, wear the pads, and so that connects to what you just said. Take care of yourself. Find out what's happening.
So, how many people do you know who've had a hip replacement?
A ton,
Quite a few. How many people you know had a knee replacement?
a ton,
How many people you know had cataract surgery?
a ton.
The rate of people having surgery for incontinence is about 1%. It's significantly underutilized when the ease and the ability to do it with limited side effects by the right doc
Mm-hmm.
is so much easier than getting your hip or knee replaced.
Mm-hmm.
So I'm just trying to encourage us. Stop thinking of these problems as just little minor issues that you have to live with. Ask the questions early so you can figure out you don't have to do anything right away, but
Mm-hmm.
start figuring out what the options are so that you can plan it and format it at the
Mm-hmm.
right time for you.
Right. Right. That is so true. Because at least we're armed with information today. But
Yeah.
in my mother's time, I would go visit her, and she took the water pill, and we would hit the streets whenever I go to town, and
Mhm.
she would take her water pill, and then as soon as we hit the house, as soon as we hit the door, she would stand up by the door and she would squeeze her knees together
Yes,
really tightly, and then she would
ma'am.
start walking to the bathroom, and I used to call it the tinkle dance,
Yes.
aka mom's dance. And it's
Mhm.
now I get it. As you get older, you got to do whatever you have to do. But to your point, get in to see what's going on.
Yes.
And that reminds me of all this. I used to love wearing jumpsuits back in the day. But now today, are you kidding me? That's an extra 20 minutes. And who's gonna hold up that when
Oh
I'm in the
no.
public bathroom? Who's gonna hold it up for me?
No. You got it. Like you got a choice. You either wear a jumpsuit and don't drink anything, or
Mhm.
you wear regular clothes and then you can have what you want. But
Yes.
that combination of drinking and jumpsuits, mm-mm.
I tell you, Dr. Walton, this has been so good. Uh, I learned so much. Even with my research, I learned so much just hearing it from a doctor.
Thank you.
You're amazing. You're
Thank you.
amazing.
Well, I love what I do. I joke and I say, I wasn't. This is not necessarily something that I felt like Jesus said, "Go be a urogynecologist," but it's my ministry.
I
It is.
love that.
It
And
is.
it shows. And it shows that you love what you do. It really, really does. Thank you so much for coming on the podcast. We really appreciate
Thank
that.
you for having me. This has been great. I love that you're talking to women over 50. I think we have finally started opening it up to say that you don't have to age in silence, that you can still be glamorous and age, right? So
Mhm.
it's just a beautiful thing that you're doing. So thank you for helping one vagina at a time.
Okay, I was about to get serious, but I love that. I love that. Okay, this is why she's called the Vagina Whisperer. We've been talking with Dr. Briana Walton. She's a specialist in female medicine and pelvic reconstructive surgery. She's owner of the Center for Feminine Wellness and Surgery in White Plains, Maryland. I'm booking a ticket. Thanks so much for coming on the show. And I'm going to include all of her contact information, her
Thank you.
social media, all of that in the podcast description. Oh my goodness. Thank you. Thank you.
No,
Thank you.
thank you. It was a great time. I look forward to talking to you again.
Yeah, maybe next time we'll handle breaking wind in public.
Oh yeah, I got a funny story about that.
Okay. Okay. All right. You've been listening to the Ageless Glamour Girls podcast, where we talk all things aging on this wonderful, transformative journey. Please don't forget to subscribe to our show, and we're available wherever you get your podcasts. We house the video versions on the Ageless Glamour Girls YouTube channel. And you can subscribe to us there as well. Now, if you want to join the conversation, be a guest on our show, email us at info@agelessglamourgirls.com. Again, that's info@agelessglamourgirls.com. And we recently started rolling out our Ageless Authors book series. So if you write your first book over 50, come on the show. We want to talk about it. And also check out our private Facebook group. It's called the Ageless Cafe. I mentioned it earlier. We call that the chat arm for Ageless Glamour Girls. We're also on Instagram and other social media platforms. And don't forget to grab a copy of our new book, an anthology, Ageless Glamour Girls, Reflections on Aging. These women are aging age from the 50s to the 80s. Let us know what you think about it. And you can leave a review on Amazon on the books page. And by the way, we're now collecting names for our second volume, volume 2. So if you want to be a part of volume 2, email us at info@agelessglamourgirls.com. Again, I'm Marquita Curtis Haynes, founder and CEO of the lifestyle brand Ageless Glamour Girls, and I'm also the podcast host of the same name. Thanks so much for being with us, everybody. Keep sharing your stories, preferably with us, but just keep sharing it. And we have so much to share, as you know. Here's to healthy aging and joyful living. We'll see you again real soon. Bye-bye for now.